It's 5 o'clock and we are right at about 100 participants and growing, which is very exciting. So again, welcome to all the members of our community. We are so appreciative that you took some time out of your evening to join us. For those of you that don't know me, again, my name is Ann Presson and I'm the superintendent for the Orcas Island Healthcare District. And this is our third community briefing of 2021. And to date, we've focused largely on, I think, what's on everyone's minds, the transition of the two existing primary care practices into a single practice that's going to be known as the Island Primary Care Orcas Clinic. I'm getting used to, as we see that on the pod, I'm getting used to having that rolling off the tip of my tongue here. We will be continuing these community briefings. They were not just initiated because of the transition. Island Hospital is committed to continuing these on a regular basis. We'll continue bringing you updates, but as we get further away from the transition, there'll be other areas of interest, healthcare content. We'll be soliciting feedback from the community to see the types of things that you'd like to hear, and we'll continue to bring those to you. What I will say is tonight, we heard an abbreviated version of what you're going to be hearing at our board meeting on Tuesday. And it was apparent the level of excitement and enthusiasm that's building as we're very, very close to the opening of the new clinic was palpable. And I'm really excited for all of you to hear what's been going on. Another exciting thing that happened this week is the giant new X-ray was delivered to the clinic. And I do want to give a specific shout out to Commissioner Richard Freilich, who has not only overseen so much of the work in the building, but specifically getting the X-ray room ready. I think he really even pulled out his hammer and and his construction equipment and just did what needed to be done to make sure we had the room ready for the delivery on Monday. So just really appreciate that. My commissioners, there's nothing they will not do to get things done, and I could not do my job without them. I'm very, very appreciative of them. And let's see what I think tonight you'll be hearing from a lot of familiar faces because we have had a couple of these briefings. You're getting to know the Island Hospital leaders from Anacortes. But tonight we are also able to introduce our local leaders, and you'll hear from them as well. And we're just so happy that they're on board and really excited for you to get to know them. A couple of logistics, Laura, if you want to just to the next slide so everyone knows how things will go tonight. I did want to let everyone know the meeting is being recorded. So if you have friends or family that aren't able to make it, it'll be available on the Island Hospital website, and I'll also post it on the notices on the district website. Everyone probably knows that you're muted, but you will be able to ask questions via the chat feature. So when we get to that point, or even, if they come up as the presenters are going, feel free to type in your questions in chat, and Laura and her team will capture those and read them to the presenters. And I think those are basically all of the do's and don'ts and what's going to happen tonight. So without further ado, it is my pleasure to turn this over to Charles Hall, the CEO of Island Hospital.
Well, good evening, everyone. We are extremely excited to spend the evening with you.
All right, turn off the TV and...
One moment. We're extremely excited to spend the next hour with you. I want to introduce you to a good number of folks here this evening who will be speaking about our new clinic here in East Sound. But before I begin, I really want to thank a number of folks who helped us come to this moment in time. In 18 days, and who's counting, 18 days, we're extremely excited to bring a primary care, expanded access, and after-hour care with specialty services to East Sound. This wouldn't have been possible without, the leadership of the Orcas Island Healthcare District, leadership, Lang, Commissioner Miller, Commissioner Freilich, Commissioner Groundwater, and Commissioner Boltner. Also want to thank Ann Crescent, the superintendent of the district, for the amazing partnership that we've had over the last year as we've talked about opportunities, whether it is finding additional access and specialty care for our residents here in Orcas, or really this partnership of bringing this clinic here to the island itself. On the screen, you're going to see a good number of very important and very valuable team members. I want to introduce who will be speaking this evening, Dr. Frank James, our new medical director of the clinic and physician who will be practicing. Elise Cutter, our chief operating officer, who is responsible for the operations of our healthcare system. Patty Codd, our practice administrator. Special thanks to Patty. Much of this would not be possible without her detailed leadership. So very grateful for you, Patty. Thank you kindly. Alora, our marketing leader, you got a chance to say hello to her just moments ago. She is our voice and she helps us communicate out to the community itself. Welcome our newest member of the Island Hospital leadership team, Amy Johnson, our clinic manager, and Shyla Wachtel, our clinic supervisor that will be here. These leaders have spent truly countless hours over the last 10 months or so, really learning about us here in Orcas and putting a model together, which you'll be seeing this evening in detail, to better serve our community here. Let's go ahead and do the next slide. Slide. There you are. I've been here for about a year and a half. I'm no stranger to the San Juan Islands, to Skagit, to Anacortes. I'm a Navy guy. This is my third time back to this region as well. Know the region in long term and really proud to be a part of this community. But when we take a look at the last 60 plus years, our community, what's here on the map, our community has been struggling to find a solution for good healthcare, for access.
It is on speaker.
Not only Monday through Friday, but even after hours.
It's all the way up.
And so as we started thinking of how to serve our community,
Your microphone is not muted.
we looked at a good number of areas, thought about the basics of the care continuum, care compliance. How do we provide a consistency, a level of approach to healthcare here in East Sound that didn't just stop when 5 o'clock came Monday through Friday, but lasted after hours, lasted through the weekend. Tonight, we'll talk a little bit about it. We considered the migration patterns, of moving from the islands to the mainland. We thought about the fragmented nature of our area in healthcare, the numerous clinics, the different healthcare systems. How do we regionalize? How do we standardize that care so there's a consistent approach to access to care? We have a long history together. We've attempted this several times. We understood the ingredients on how to come together. In fact, when we were here a few years back, part of those ingredients didn't work, and that was the economic side. We believe we've been able to solve the economic side. Not that primary care clinics make money, because they don't, and not that Island Hospital makes a lot of money, because we don't. We're here for mission. We're here to deliver care and do our very best in delivering
Doesn't work with shit.
to our Orcas residents. And
God
everyone
damn it.
has a-
Hard enough to do this all by itself.
With that being said, the collaborative vision over the last about 10 months as we worked with the district here and the leadership here, we wanted to provide primary care, specialty access to care. You'll hear about this evening. After hours, including touching base with the provider after hours via phone, or even if needed to come in late at night on weekends to the clinic, we're able to provide some acute care for you. A collaboration with EMS, a partnership, a true partnership with EMS, and that allows them to be supported by us and us to be supported by them. a true engagement model where education, population health, an ability to come in here and talk about diabetes to our community, emergency preparedness. When bad things happen, look at this pandemic. How do we play a role with the county, with the community to make sure you all get the very best care possible? And now that we're in COVID, we'll talk about that tonight as well, about a COVID clinic that we're working closely with the team in, and how we'll continue to support us here in Orcas with COVID vaccines. Next slide. Takes a moment here.
Charles, this is
Yeah.
Anne. I just wanted to, while that's loading, just want to remind everyone, if you could please put your phone on mute. We're getting some background noise. I just want to make sure if everyone could take a moment to double check that, your phone or your computer. Thank you.
Thank you, Ann. Well, we look at this model right now, and this is where we have struggled over the years, multiple clinics, trying to organize us, the resources, the healthcare resources within this area. How do we organize ourselves? There's a lot of elements to it. Resources, providers, staff, an economic subsidy to keep a clinic afloat. These are all key factors that have plagued all of us throughout the years. The wisdom of the board about a year ago, as they thought about this model, as they looked at the experience of the past, how do we not only survive, but really, really thrive and not struggle to survive with healthcare resources here? This was one of the big dilemmas, multiple clinic models, financial support, limited after-hour coverage that really produced quite a bit of flights off the island, expensive flights off the island. And as we began to work together, we wanted a one clinic model. We learned that of our past as well, that when we were here, we struggled for a number of reasons, including these. We thought about how to keep care local, close to home. That's compliance to care. That's a healthier community when care is closer to home. How do we add more providers, specialty services, peds, women's health, behavioral health? We'll talk about that tonight. A partnership with EMS, a true partnership, social work services, a level of service that thinks about when you have to go to Anacortes, to Island Hospital, that you have us thinking about the ferry schedule and getting you there, but getting you back in time. And then that engagement we've talked about with the community, whether it's civic organizations or the chamber, the business, the idea of really being here with the community. Next slide. So when we thought about this, we had a number of goals, quality goals, increase access, increase specialty access, a sustainable model, physician and staff retention, not only recruitment, but retention to help support a group of healthcare professionals who call this home, that both the work and the home are properly balanced. When we looked at these goals and we tried to dig deep, we looked at the industry standards. We looked at quality standards. We looked at how many more providers are needed to be able to create more clinic access or after-hour access. We looked at the economic model on how much volume is really needed to sustain a clinic like this, and how much support from a system like ours is needed. And we've been successful, as we've introduced in our last community briefing, Dr. James Franks, which I'll have spend, Frank James, I spend a little bit more time with him here in a moment. We've hired a manager, we've hired additional staff. Tonight you'll hear about an after-hour program that's really above the national standard, above the norm. You'll hear it and you'll feel it because these are top docs that will be spending time with you after hours. But before we kind of take those next steps, I know as we've looked at the questions that have come to me, the questions that have come to Ann, the questions that have been on the blogs or on the newspaper, We want to know what went differently with the UW providers here. And let me talk briefly about that because I think it's important. Want to honor them as well and definitely thank them for the years of services. We spent quite a bit of time together. We talked about this model, a similar model that we have in Island Hospital, an industry model that is not much different than across the United States. We took into account the unique nature of island and remote care. We talked about efficiencies through the clinic. We talked about the access, not only in the clinic, but after hours and an after hour model. We had a generous package. We used a compensation model, not all differently than what we have in Anacortes or really that we've experienced across the nation. And I know that they've taken serious consideration to it all, and it wasn't quite for them at this moment in their career. We definitely want to thank them for their leadership and spending time with me and our team in really exploring this option. Next slide. Takes a moment to load. But I want to introduce to you Dr. Frank James. Many of you know him throughout the years wearing multiple different hats within our region, within our community. Right now, most recently, wearing the health officer for San Juan Public Health. He's worn that hat in many different roles throughout the region itself. He's a professor at the University of Washington. He's a medical director of current and of the past. He's most importantly a physician. He's a clinical physician that will be working in our clinic here, caring for you moving forward. He's with us here tonight. We're all broadcasting, well, some of us broadcasting from the Orcas Fire Department. I'm here with Elise Cutter and Dr. Frank James. So without further ado, I'd like to introduce you to our medical director of Island Primary Care here in Orcas, Dr. Frank James.
Good evening, everybody. I do realize that many of you know me as the health officer. Some of the things you may not know about me is the other things that I've done in the past. I have been your health officer for almost 30 years. I'm also the health officer for the Nooksack Indian Tribe. It's a small job, but an important one for a group that has been marginalized for many, many years. And I've been working with them for about a decade now. In addition, I was the health officer in Whatcom County for about 10 years. And also the director and the health officer, both for both those health departments initially, and I eventually turned over the administrative duties to other capable hands. In addition to being a professor at the university, which is a fairly small thing, I'm a clinical professor, I have created several different clinics, specifically early on in Bellingham. There was a big need for uncompensated care for people who couldn't afford to go to the doctor. I created a sliding fee scale clinic there that grew from one doctor and then to a couple nurse practitioners and a volunteer dentist. After about 10 years, it saw 50,000 visits a year and had 7 full-time physicians, 4 nurse practitioners, and 7 dentists. That's probably one of the things I'm the most proud of in my entire career. That clinic has changed names, but it continues to function. It went from Interfaith, which is a coalition of the faith community there, for the first 15 years, and it's now called Unity Care. They have 3 sites, and it continues to see the same number of people we saw back when I finished my tenure there. It was a difficult thing to build, required financial innovation and ingenuity. It required becoming a federally qualified healthcare center, so jumping through a lot of technical hoops to get there. The other thing I've done more recently is I, together with 2 large businesses in Bellingham, founded a clinic that actually was direct care. It went around the insurance industry and around the pharmaceutical industry and provided dispensing all major medications directly to patients at cost, and saves the 2 companies I work with about $100,000 for one and about $200,000 for another, and without going through the insurance system. There's that much excess funding in the insurance and pharmaceutical industry that we were able to do that. The reason I have time to take on this project and the reason I choose to take on this project is complex. I am cutting back a number of other duties that I have. I'm still going to remain here as health officer. That's a 1-day-a-week job, a little more now with COVID. But I'm cutting back on a vaccine trial I was running. I was running a phase 3 vaccine trial for the Novavax vaccine in Native American people. That was a big challenge, but a commitment I've made to Native people for many, many years. But I'm able, now that it's fully enrolled, to give those duties off to somebody else. I have had to quit my clinical practice in Bellingham because of the great demands of COVID a number of months ago. So I don't have a primary clinical practice now. And I really missed it, honestly. And now that COVID has the promise of being controlled, perhaps as soon as July, in my judgment, I think there's more room on my plate than I had before. The actual ideas, so that's the pragmatics of why I have a little bit of time to do this. The things that attracted me to it were really the strong partnership between the healthcare district and the hospital. A fundamentally sound financial model. I've watched Orcas over 30 years now, and part of the problem was there was always multiple practices. And there's only a certain amount of money in a community, and you have to have a certain number of patients to have a productive practice. And I think this one clinic model for the entire island is a very important fundamental step that will make a thriving, successful clinic possible. The other thing was that I was very impressed by the clinicians that are on board now, the physician's assistants that I'll be working with. I'm really looking forward to working with. I spent a good deal of my career working with ARNPs and PAs, and they're the best value in medicine. They do 80% of what a doctor can do, and the 80% they do better. So I'm excited about working with them. There's a strong commitment on my part to the island community. I mean, I've been here for 30 years for a reason. It's a mystical, magical place, and Orcas is the center of that magic. It's been a place that's always very much attracted me, and I've really admired the broad diversity, integrity, intelligence of the people that live here. In brief, I sincerely believe together we can build a solid foundation for healthcare on Orcas far into the future. I think it also builds on a regional approach with the hospital providing services to people outside of the Anacortes area. And I think there's room for growth even more. I see that as part of the future. The district board is very strong. It has really a tremendous unifying factor in it. Ann Preston's presence and leadership has been critical. And Charles Hall is really, as I've gotten to know him, I have substantial respect for him. I think the integrity, commitment, and leadership of those people are what has attracted me. It's a team, and it's being a team effort is really going to require commitment on everybody's part, from the board members to the individuals in the community. It's going to rely on you to believe in the vision and to participate in it. San Juan County has been the healthiest county in the state since Robert Wood Johnson started measuring it some 20 years ago. So we have a solid foundation of community health to build on in this region. And it's one that I think will continue to make our work better. And as we build those community health structures, we can make it stronger. Often people relate to hospitals and clinics as disease care. They're where you go when you're sick. My vision, and I think a vision that I share with Island Hospital and your local commissioners, is that we really care about health and not just disease. We want to provide people those fundamental tools to keep themselves healthy, to keep them out of the clinic, keep them out of the hospital. That's the long-term goal, and one that I hope that we as a community can embrace and come to make a reality. The potential is not just to improve healthcare on Orcas Island, to be actually a model for other communities. I think that's one of the valuable things. The epidemiologist in me reaches out and says, where's there a population you can actually measure the impact of what you do? And island communities are ideal for that. We'll know what works and what doesn't work, and we can keep going with what works and change what doesn't work. I think that my goal is to have an entirely healthy community for everybody on the island, not just the people that come to the clinic. And I think we've made good progress in that direction as part of this larger community of San Juan County. You can move on to the next slide, please. Thank you. I think there's a global vision for Orcas, and the clinic here and what it can mean. Everybody being served by it, working as a team, and going steadily forward and not backward. If we're looking backward, we're going to trip and fall, and we shouldn't look backward. I think we need to stand on the shoulders of the people that have done the work in the past, but we really need to keep looking forward and identify what our goals are as a community, how we want to succeed, who we want to serve. My vision is it's got to be that we serve everybody, every single person here. That's why the one clinic model, I think, is the foundation of what will make us successful. The tough nuts to crack here have been very difficult. I think tonight, what you're going to hear about in the after hours call program is a very solid, realistic plan. And I think it's one you're going to like. When you call, you're going to be connected with a physician. There are 5 physicians on call, and Island Hospital can have that kind of resource where they have 5 different physicians on call every minute of every day. And when you call and you need care, you're going to talk to a doctor. They're either going to solve the problem with you at the time, or they're going to, if you need emergency care, they're going to facilitate you getting that emergency care. And when those 2 needs are taken care of, the third option is going to be, we're going to come into the clinic and see you in the clinic day and night. So that's the system that I think is incredibly important to have, where those urgent things can be dealt with. We have 2 different clinics in this one clinic we're talking about. There's kind of subparts to them. One is the urgent care part. In the summertime, a huge number of people come here, and we're going to be taking care of those people in an urgent care fashion. In addition, there are some individuals who have a primary care doctor off the island and come to the clinic for urgent care. We've got to do both those things and do them well. I think we have some learning and growing to do on how to do that, the very best we can. It's a very tall order to do both urgent care and primary care, but it's part of the challenge, just like the after hours call, of making things work. And it's one thing that I think we can do much better in partnership with a large institution like Island Hospital. Next slide. We're not going to be able to do everything at once. Anybody that tells you they can solve all your problems simply and easily is selling you something that you don't want to buy. We're going to have to make a transition. That transition is going to have kind of a 2-month phase and about a 6-month phase. And after that, we're going to be in a stable position where we're going to have what I hope is the staffing and the structure that's going to last for a very long time. We are going to have some transition providers coming in temporarily. The one that I'm most excited about is Jason Hogue. He's both a very successful family physician at the Island Hospital system. In addition, he also runs the urgent care and the walk-in clinic there. I'm really looking to him to help us get ideas on how to solve this dichotomy of being a walk-in clinic and a primary care practice. He's figured out how to do it in Anacortes. We need his ideas here. By having him on staff, I think we stand to benefit a great deal. We'll also have a couple of other physicians helping us out for the first few months. Michael Gravitt is a well-qualified primary care doc that's going to come in and give us a hand for about 6 months to make sure we've got adequate staffing. Susan Jordan is a physician's assistant who's going to join our other 2 physician's assistants when we have the need. And Les Conway is a doctor that trained me when I was a kid. He was one of my teachers when I was a young family doc. I really respect him, and I'm glad he's willing and able to come out and give us a hand. The providers that we have now is an impressive list of people. Let's go on to the next slide. As you can see, there's a variety of providers. Some of them you know already. Karen Kaylee Orr, a physician's assistant, and Jennifer Utter are 2 people that are well known in the community here. They're very capable, very competent people that I'm really excited about having on our team. They're going to provide a lot of continuity and they're going to provide the kinds of care that physicians' assistants can provide. They really are wonderful people, warm, kind, thoughtful, and the kind of people that I think are going to be the foundation of the people I expect to be the models for other providers as they come here. I'll be there. I'm not going to be there initially, except in the medical director role, and that's because it takes a while to get credentialed in these systems. It's going to be probably mid-May when I'll be able to start seeing patients. I'm very excited to start seeing patients, and the credentialing process just takes a while. I'm really excited about being here. The other people we're bringing in are going to be John Peterson. He's a family doc in the Island Hospital system. He's going to be out a few days a week, and one of the people I'm most excited about, kind of our anchor persons, is going to be Kathy Gard. She's an OBGYN, so she'll be there for the chronic gynecologic problems, for the complex gynecologic care, and as an active obstetrician as well. She had an early interest and a strong interest in supporting us. And Brandon Green is another person that's going to be coming out. He's a pediatrician. He'll be not only taking care of the more complex children, but helping teach all of our primary care providers that practice here, just like Kathy will be doing in gynecology, helping to teach and give direction, take the most complex patients under their direct care, and continuing to work with us as we move along. We hope that pattern will expand into behavioral health as well, where we'll have psychiatric services available. Again, with the same model with Kathy and Brandon, we'll have people coming out on site and seeing people in an initial visit, and then either traveling to the mainland to get their follow-up care, or if they're stable enough and the care is appropriate for primary care, that they'll be handing some of those people off to us that are in the primary care clinic. I might mention that Brandon has a special interest in special competencies in dealing with autism. There are quite a few kids with autism in our community, and that's, again, a very unique and special talent that's going to be brought to this primary care clinic that wasn't there for others. We also hope to capitalize and continue to do telemedicine so that we can utilize these people when they are on site, but also utilize them when they're not on site, particularly with behavioral health. I think that's important. It's been a very successful model in the behavioral health area. There are many other areas we hope to build on that core model of having people come out periodically every 2 weeks, once a month, but extending that through our relationship with Island Hospital. That would be general surgery, that would be urology, that would be in a number of other areas. So that's the team that's going to be on the ground kind of from the beginning. In addition, we are interviewing today and tomorrow a family doc that's well respected and would be a powerful addition potentially. We're also talking to a nurse practitioner that lives and works in the islands. Both of these people are people that know about the community here. They've lived in the islands for a long period of time, and I think are going to be, if it works out, once we've done all the interviews, strong additions to our staff. So we're really looking at a broad range of people. I'm excited to be able to have a role in bringing some of those people in. If you talk to people that work with me, you'll know I have very high standards and I expect the best. And I think we can attract outstanding providers to this community. Next slide. I'm going to turn the discussion back over to one of my colleagues, and I'll be here at the end to answer more questions when there's time for it. The final thing to talk about here is going to be the clinic leadership. Obviously, I'll be the medical director. That'll be a small portion of my time, but a significant portion. I'll be trying to lay the fundamental groundwork for building the clinic. Amy Johnson, many of you know. Amy, we're bringing over from Dr. Shinstrom's clinic. We're very excited to have her. And Shyla Wachtel will also be coming. I knew these two women before, but what has knocked my socks off about them is how they have really had a strong leadership role in the COVID response. I've gotten to know them quite well in that respect, and they are incredibly capable, organized people. They've done what the university clinic couldn't do, and that is deliver both testing and immunization services in a very difficult situation. Their capacity and their compassion is great, and I really respect them, and I'm delighted to be on a team shoulder to shoulder with them. Someone most of you don't know is Patty Codd. Patty is a person that is at Island Hospital. When I met her, I was sort of impressed. And then I had lunch with the doctors there, and I asked them about Patty, and they all could not have been more effusive. She saved their bottoms many times, and the stories they told me and my subsequent experience lead me to believe she is the absolute linchpin as a practice administrator, and that the deep coordination at that team level with Island Hospital. Couldn't be happier to have the people you're looking at on those slides working with me shoulder to shoulder to make the infrastructure work so the providers are able to provide you care. That's the end of my part of the talk. I'd like to turn it back over. Charles, who's next?
I'd like to introduce you to Patty Codd, our practice administrator, and Amy Johnson, as we start talking about the next couple steps, the next few weeks on what to expect in our timeline, and an overview, an in-depth overview of our services. Patty?
Oh, there we go. Good evening, everyone. I want to start by thanking Dr. James for
on mute.
What's that?
Moment.
Am I working?
Yes.
There we go. Good evening, everyone. I want to start by thanking Dr. James for your kind words. I think I might have blushed. I appreciate it. Start first with the services that we're going to be able to bring to the clinic. And these services will be available day one when we start taking care of all of you. Primary care and same-day appointments, preventative and chronic condition management for both adults and pediatrics. We'll help coordinate when there's more acute need. We will do injury management, laboratory, and that's going to include labs for those who are patients of our own providers, but as well as providing that service for patients for external providers as well. We will continue the COVID-19 testing. Diagnostic imaging, you heard us talk about our brand new X-ray machine, and that's in the works. EKGs, immunizations, both adults and kids, and prenatal support services, and our nursing services. We hope to layer on pretty quickly after the dust settles. You heard Dr. James talk about the pediatric services, the women's services, but also bring out the urology services, general surgery follow-up, GI services, the psychiatry support. There's two layers to that Dr. James spoke to. That is telehealth services as well as on-site services. Those will be services to our patients, but also support to our providers by psychiatric consult here at Island. COVID vaccines, which we'll talk a little bit more about later. And all of these will be telehealth or in person. So next slide, please. I want to talk a bit about the clinical team. This really is the foundation of our ability to be successful in providing safe, quality care, not only to support the providers, but for the team to be able to support each other. We need to have a robust team and have enough people supporting the providers, supporting the patient care, and supporting each other. I'm so excited that we've been able to bring along the teams that you're used to seeing. And we've added a few, and we're going to continue to add. We're also going to add what we call reserve staff. So build a bench around each one of our positions in the clinic. And I'd love to hand this over to you, Amy, for a moment to talk a little bit more about our staff. If I can introduce Amy to everyone.
Thank you, Patty. And good evening. Thanks everybody for being here. I want to just say that I'm really looking forward to the amazing staff at both of the offices currently coming together. We have a history of already working together collaboratively, brainstorming behind the scenes, making phone calls to make sure that we can figure out how to take care of a patient, sharing supplies. So we already have a history of working together, and this is just going to get even better. As Patty spoke to supporting each other, I think that the call center educated in Patty's going to speak to that in a moment, but educated especially for us, it's going to help take some of the burden off and allow our staff to really join arms and take care of your needs. I want to thank both of the staffs for coming forward and wanting to stay and bringing their skills that are so needed, and we're going to put them to use. I want to thank Dr. Frank James for your kind words and coming on board. This is going to be really exciting. I think the connection with the health department and the local providers is going to be so valuable going forward. It's something that's been kind of missed, not just because of Orcas, but just generally. I want to thank the healthcare district for making all this happen and making it a goal, and Ann Preston and your tireless conversations and grace and efforts behind this. And then I really want to thank the Island Hospital leadership team. They have been communicating with us and being very active listeners with all of the staff in trying to figure out what is going to work best for us. And they made a commitment to the healthcare district that the current staff that wanted to apply and stay in the game and provide care for the community would be hired, and they made it happen. They did it. And I'm really looking forward to it. I'll turn it back over to you, Patty.
Thank you, Amy. Kim, next slide, please. So a little bit about what our go live is going to look like. So April is our transition month. We will start seeing patients on the 5th. We will have the providers that Dr. James spoke of every day to support the care in the clinic. We will have reduced schedules, the provider schedules, the nurse schedule, and our lab, to ensure that we give our teams the time and the support to get fluent on the EMR. We will do well child appointments, but we're going to hold off a little bit on the adult well visits to ensure that we've got the capacity to manage our chronic disease or our sick patients. We'll move into May. You'll see a little bit of a decrease of the Island Hospital physician presence. And Dr. James will also begin seeing patients, as well as Dr. Gavad. And we will then be able to fold in the adult well exams as well as everything else and expand the lab schedule at that time. So next slide, please. So I want to talk about our care support team. We are so excited about a new position that we have put into the clinic in this patient liaison. I'm terribly excited about the position and the linkage that that's going to provide, not just for our patients, but for our clinical teams, so that they're not the ones having to kind of iron those details out to make sure that any care that is happening off the island, or even, just labs that you've got your authorizations and those kinds of things. But I have to tell you, I am most excited about the fact that Nisha has fulfilled this role for us. Nisha, I had the opportunity to work with Nisha before when we were out there, and I was delighted. My fingers were crossed that she was going to apply, because she is going to be that person that all of us are going to be able to lean on, whether we're a patient, whether we're leadership, or we're in the clinic, to make sure that we have all those linkages and those connections working smoothly. The rest of the team that you see here pictured is our awesome call center team. I can tell you that we have spent several wonderful sessions with this team talking about Orcas and educating them about the uniqueness and kind of those nuances that matter when you're on an island. And they've all been very eager to learn. We are huddling often. We opened up to appointments on Monday, and we have huddled every day with the team. They're doing a great job of bringing your questions directly to Amy and I. Amy and I met with them just this afternoon, right before this meeting. And it gives us a quick fix to any questions that we didn't think to put in their scripting ahead of time. So, and I have to say, in 3 short days, I've already heard from some of you in the community with some very kind words of appreciation for our call center team already. Our goal with the call center team is going to be to answer your calls within 2 minutes. Ultimately, our goal will be under 1 minute, 30 seconds. And call back, you'll notice you will have an option to leave a message. If there's a little bit of a wait and you don't want to wait or can't wait, you'll be able to leave a message. And our goal is to give you that call back within 8 minutes. And we will be tracking those metrics and working hard. And Amy's a numbers gal, so we're gonna have fun working with our team to achieve those goals that we've set. Next slide, please. Some important dates to put out there. Friday, March 26th is the last day that UW will be doing in-person care in the clinic. Then starting the next week, Monday, we will be doing a new employee orientation on campus out there with our HR team. We will be training our staff and our providers that week. UW will be taking out their IT equipment, phones, those kinds of things, and then our team will come in behind that and set up our equipment, our EMR, all of our devices. During that time, UW will offer telemedicine, and we will be supported in after-hours care by Orcas family. April 1st and 2nd, the care shifts to Island Hospital telehealth at that point, and we will be continuing the training for our providers and our staff. Monday the 5th, we open to in-person visits in the clinic. As I said, we'll have reduced schedules for just a little bit, and we will actually have a team on site at Elbow with the providers and the staff to ensure that there's no disruption in care as they become fluent on our EMR. You'll call the number down on the bottom of this slide for all of your appointment needs, questions, anything. This is the number that you, just one number, and it'll get you to our care support team. Next slide, please. Dr. James spoke to our after hours plan. I just want to give you just a little more detail. You'll call this number, the same number that you'll use to call during the day, you'll use that same number to call at night. That will connect you with our answering service, who will have a good understanding of our Orcas community, and they will ask the right questions to make sure they get you to the right level of care. And they will have a physician give you a call back, as Dr. James spoke of. That physician will either be able to work through your issue with you, potentially have you come into the clinic the next morning. If it's an emergency, they'll be able to connect you with EMS. If it's something that needs to be seen in person in the clinic, our physician on call will contact the provider on island on call, and they will be able to take care of you in the clinic. Next slide, please. I want to pass all things vaccine over to Elise Cutter. Elise is our COO, Chief Operating Officer. She is coordinating everything COVID for our organization and is doing an absolute amazing job. Daily, I am impressed by the work Elise is doing. So Elise, it's yours.
Thank you so much, Patty. I appreciate that. I'm Elise, as Patty just said. I'm the Chief Operating Officer and have been charged with standing up our incident command during the COVID pandemic and working on vaccine distribution and COVID testing. So that's no different now that we are going to be on Orcas, and I have had the true pleasure of working with Amy and Shyla from the Orcas Family Health Center, as well as Ellen and Steph from San Juan County Public Health, to really work during this transition time to ensure we have vaccine that continues to come to the Orcas community and not miss a beat while we're transitioning the 2 clinics into 1 and Island Hospital coming out. And again, Amy, Shyla, Ellen, and Steph have been amazing to work with. And I'm happy to report that through that partnership, we were able to get vaccine here to Orcas Island this week. Shyla will be working the vaccine clinic tomorrow. We have 50 Orcas residents scheduled for their primary doses tomorrow and 40 on Saturday on the 20th. And we will have the Moderna vaccine. So that's a 2-dose vaccine. You'll have the first dose and then 4 weeks later, the second. We have at this time worked our way through our over 65 wait list. So again, if you're listening and you qualify in any of the current phases that we're in, please contact this number, the 360-376-7778, option 5. Leave a message and we will call you back and get you scheduled for a vaccine. We want to make sure that we are staying within the tiers that or phases that the governor has set. So again, we have over 65. We have first responders that are eligible, school teachers and staff of school district, daycare providers. And now on Wednesday, we just moved into our next tier, which includes essential workers like grocery store, transportation, ferry workers, people that work on fishing vessels, etc. As well as those over the age of 16, if you have Pfizer, or over the age of 18, if you have Moderna, which is what we have, that are pregnant or have a condition that puts them at risk of severe COVID. So again, if you or you know somebody here on Orcas that meets one of those criteria, you can always go to Phase Finder, which is on the Department of Health website. It'll let you know what phase you're in and if you qualify now. And if you do, or someone you know does, please have them call this number and leave a message so we can continue to work through our callback list. So we'll continue working here, Island Hospital, along with Amy and Shyla, to place orders with the state to get vaccine, as well as partner with public health. Again, Ellen and Steph and Amy, Shyla, myself, and Patty have a standing weekly meeting so we can review what vaccine is going to be coming into Orcas and the best way for us to distribute that to the residents. So it's been a true pleasure to engage with San Juan Public Health, and then Orcas Family Health Center has also enabled this to happen. So as Dr. James mentioned earlier, they've been true rock stars here as we go through this COVID process. So next slide, please. So what to expect? Patty talked a bit about the logistics of the clinic and care at the clinic, but I wanted to just touch base on kind of some of the bigger picture things here as Island Hospital comes out to Orcas and we become part of this community, which is truly our goal. Prior to opening the clinic, excited to bring primary and specialty care and community education. If you've been on prior briefings that we've done, you've seen some of the classes that we hold. And one of the things that COVID has brought about is everybody's used to these Zoom or WebEx meetings. So we've really been able to offer some great classes virtually. And Laura, who you saw a picture of earlier, runs that department and has done a phenomenal job. And I think you will really enjoy the content of the classes that we have available virtually. And then once we get back to some in-person classes, absolutely bringing those here to Orcas Island as well. Community briefings. Anne mentioned at the beginning that this is not kind of, you know, a one and done just during the transition. We look forward to having these community briefings on a regular basis. Our next one will be early May. We'll have at that point been operating the clinic for a month, and we'll be able to talk about any bumps in the road that we have and our solutions for those, as well as talk to you about provider changes and the longer term providers that will be on island, as well as services that we'll continue to add, as Patty referenced. As we get those foundational building blocks in place at the clinic, then we can layer on those specialty services, additional telemedicine, et cetera. We would also really like to celebrate opening this clinic. It has been a long time coming. We've been working with the healthcare district out here for several months now. We're really excited to be here, combining these two practices into one. The staff are excited, we're excited, and we want to be able to celebrate that. Safely, of course, during times of COVID. So we'll space ourselves out, we'll wear masks. But the week of April 1st, we're going to look to plan, a ribbon cutting or something of that nature, so we can truly celebrate and just show all of you on Orcas how glad we are to be here and how excited we are to take care of you and your medical needs. And then what we also want to do, and what we do in Anacortes and in the surrounding areas, is our leadership team really participates widely in civic organizations, whether that's Rotary, we have the chamber events, etc. We really want to become part of this community and not just some organization that's over there on the other side of the ferry. So we'll be looking to leaders here and talking with Ann and Dr. James of what are those organizations that we really need to get in front of, participate in, and partner with, so we can bring the best healthcare experience to Orcas residents here. And lastly, a little bit about our Island Hospital Foundation. One of the things that we wanted to make sure, again, as we ingrain ourselves into this community and really become part of it, was to ensure we had some Orcas residents on our foundation board. So we'll be working again here with some community leaders on who that board member may be and work out a process for identifying that person. And then exploring kind of the model of what could this look like going forward. So again, we are using our foundation in a process for fundraising that's already set up to do things that benefit the Orcas community and healthcare here on the island. So again, we're just really excited to come on board. We are, the Lions, thank you. I just saw somebody put that up there. Awesome, that's what we need to know. We're really excited to come out here the first week of April, and we're, Patty and our team are gonna be out here the week before getting things ready. And looking forward to seeing all of you and meeting more folks here in the community. So thank you very much. I'm gonna turn it back over to Charles.
Thank you, all the leaders that have participated in this evening's presentation. I know we have a number of questions coming from the chat room, as well as the Q&A side. Laura, do you mind leading those? I do have a little bit smaller screen here, and
absolutely, yeah, happy to do that.
Able to see the print.
So there were a few questions that came to everyone, and then a few to a few individuals. So I want to make sure we get to those as well. I'll start with the chat that everyone can see. The first question is, will there be mammography services? Charles, would you mind addressing where folks should go for their mammography services?
We do at Island Hospital have these services available in our strategic plan for this year and the next year. We're looking to expand the services, make them a little bit more current. And what I mean by that is, as we build and focus on those services, when you come in to see a provider, our hopes are we continue to build a model that focuses on same-day results, and that's planning for the near future around the corner. Of my past, the mammography services that we brought are the RVs that come over to this area. And it's something that we'll probably have to explore here to see if it's a feasible thing, but it would be something that we'd be interested in looking into.
Let's see, there's another question about the services to the outer islands and the role that telemedicine could play specifically to Waldron, which has long-standing ties to Orcas Island. I don't know if Dr. James has any thoughts on serving Waldron Island.
Right now, the health department is planning on bringing those vaccine services mentioned in the question out to Waldron. We're going to be bringing them in the near future. We're looking at how we can do other remote places as well, but we're starting with Waldron. That'll be the first island we'll take service to, and that should be in the next week or so.
Thank you. Patty, I have a question here for you about, oh, sorry, Charles, go ahead.
We do have telemedicine services at Island Hospital, and those are readily available to our whole community, our whole region, including Waldron, if they have access to the internet. Primary care services and many specialty services, including behavioral health, are active and well throughout this whole region with patients from all corners of the San Juans.
And telemedicine in general, I think, has become a mainstay in many ways of care during COVID times. I think a lot of that function is going to continue on for the more remote places. It's a lot easier to get on the computer than it is to get on a boat and travel and come back and take a whole day to do it. I've utilized those services myself to some extent, and I can tell you, I think it's a very convenient thing. I like to do it from home. Sometimes do it from my pajamas even, you know, it's an easy way to do things. So I really think that telemedicine is here to stay. And I think for those things where telemedicine is appropriate, it's a great way to outreach to those outer islands.
Thank you. Patty Codd, I have a question for you about Medicare and how someone with Medicare would go about changing their primary care physician through this transition.
Thank you, Laura. Just call our call center, that 293-3101 number. We'll get you set up with an appointment and establish care with your new provider through that appointment.
And Patty, just to clarify, folks can call starting this week, right?
That's correct.
Thank you. Let's see, there's a question here about how many patients the providers will be required to see per day. Charles, thank you.
I think in the economic model, we understand 16 to 18 patients a day helps keep the clinic right side up. Those are generally the milestones that the industry tells us, and that's true in this model as well. We also take in consideration the unique demographics of some of the internal medicine, the complex care that our bodies, especially here on Orcas, have, and we've taken those same considerations at Island Hospital and compared it to the industry. And so that is our goal. It's the sweet spot of about 16 to 18 patients a day.
Thank you, Charles.
Add to that one of the concerns that some of the providers expressed to me as I explored whether or not I would take this job on was that they felt like they couldn't see that many patients. And I think the difference is that we're going to have a lot more support than they ever had with the university. The additional specialty care coming out here for some of the more complex patients, the ability to get people efficiently to those specialty visits and back again. There's going to be people to help us do that job, and I don't think we're going to feel like we have to take definitive care of the most complex patients. We're going to get those complex patients to the people who do complex care in a timely and efficient way. And I believe the system that Charles and his team have put in place is going to support us so that we're able to do that.
Thank you. Question for Anne, will there be any construction on the building to provide space for new services? Is that something that is in the works or has been talked about? Anne, are you able to unmute? Let's see.
Laura, let me jump in. Oh, is she there?
There we go. There we go.
Oh, okay. Sorry about that. I thought I was unmuted. Can you hear me okay? Yeah, I was just, I was saying that, yes, we have had some general conversations. We obviously have the space. And so I think as Patty and team would like to see how things play out before we begin any remodeling, but we definitely have it on the radar.
Thank you. And there were a few questions that were sent to individuals on the team here. I want to make sure that we address those. Charles, I'm wondering if you can speak a little bit more about why we weren't able to retain the UW docs.
Absolutely. I think part of it is the numerous conversations we've had over the years. We spent over the year, I spent quite a bit of time in talking with these providers about the model, about the industry standards, about the quality itself. We did offer a compensation package that was in line with every other contract that we offer at Island Hospital, and a recognizable contract that you see across the nation that took in consideration the dynamics here. And each provider had a choice on if that was right for him or her. And in the end, the model that we have here was not attracted to them, but definitely was attracted to others, as have we seen high level of good recruit physicians to Island Hospital and to our clinics. I know this is a private decision that every provider makes as they look at their next steps in their career. I do respect that, and I wish them well.
Thank you, Charles. And Charles, perhaps you can answer this one too. How many providers will actually be in the clinic? Do we know what the total number will be as of right now?
Our goal is to have 4 providers Monday through Friday. It's a mix of physicians, PAs, and nurse practitioners as we move forward. As Patty also talked about a little bit earlier, it's a little bit slower ramp up as we learn the clinic and put our processes together. The great news is much of our team, our providers, our Island Hospital docs, it should start as a fast start, but there is room for transition as we put all the practices into place, get our EMR, electronic medical record, up and going, and then ramp up services over the coming weeks.
One more for you, Charles. Wondering if there's been any talks with any female GPs other than Dr. Gard. You're muted, Charles.
We have 3 and soon to be 4 OBGYN provider. The 3 of them currently do rotate to Friday Harbor on a regular basis to see patients over there. Dr. Gard, our medical director of clinical services for our healthcare system, was the first to raise their hand saying, "Send me, I would love to go to Orcas." She represents our women's services as well, and she'll help spearhead additional services here.
Thank you. 2 questions that I can answer. One was, will the slides be provided on our website? Absolutely. It takes a few days for us to download the presentation from the cloud. So as soon as that is done, we will post that on our website, hopefully early next week, and you can view that at any time. And then the other question was, will there be bios on our website? And absolutely. The team and I are working on those right now. We have some photo shoots scheduled with the providers, and we will add those bios to the website and also produce printed bio cards as well. There were also a few questions that appeared on my screen, but they are not staying in the chat feature. So I just wanted to ask my team if you're seeing any other questions that I wasn't able to ask the group.
There was one that came to me from a person that was not able to. There was one that came to me from a person that was not able to access the Everyone button, so it came specifically to me. And it's just what's covered in GI services. Gastroenterologic services are going to be those basic services that are really important to everyone, from your lips to your bottom. They'll look at everything there. Some of the more technical things that require more equipment, we'll probably be referring people over to Island Hospital for. But this is going to be everything from GERD, gastroesophageal reflux, or heartburn to stomach cancer, and everything in between. So those diagnostic procedures, we'll have to send some people to Island Hospital to get them. Over time, we may see those procedures over here. For example, colonoscopy and endoscopy, but I think that would be in the future for now. So GI services, Many people have hepatitis B or hepatitis C. Often a primary care doctor can take care of some of those problems. I certainly take care of a lot. I've done research and teaching about hepatitis C and hepatitis B and hope to take care of some of those patients myself. But the gastroenterologist is an expert just in the GI system and will be addressing those issues.
Thank you, Dr. James. I have a few more questions here. We're wondering who of the providers may be the most sensitive and knowledgeable about elder health issues?
Well, from my point of view, I can say that every family doctor, a big chunk of your practice is our elders. They're the people that get the most care by far in our healthcare system. And so I think any family doctor is going to have a lot of experience taking care of elders. I certainly do. And they're the people I value the most. They've got a lot of wisdom to teach me in addition to what I try to provide for them in care. So I think all your family doctors can be there in that realm. I think that there is room for specific geriatric care. We don't have a specialist in that right now, but that's something we'll look to, and we'll look to our partners at Island Hospital to help pave the way for those kinds of services, either periodically or perhaps in the long term, someone on staff with that specific training.
Thank you. Let's see, Charles, someone is questioning about locums, and the person asks, I have the impression that only locums have been recruited to serve the Orcas facility. Can you speak a little bit about which physicians are locums and which are not?
Yeah, give me one.
Actually, I've been really concerned about that. I'm not a big fan of locums, and we do have one locum coming in for a 6-month period. I'm really excited that he's coming here because it's a time when we really need somebody to do that, not the primary family care, but the urgent care. So I'm really excited we have somebody to take that part over for about a 6-month period. The other people, if I understand correctly, Charles, you can correct me if I'm wrong, but there aren't any other locums. Yeah. So these are either going to be permanent staff here or people that we're developing a long-term relationship with at Island Hospital. We did feel we needed that 1 6-month period where, particularly for the urgent care stuff, it's really hard to take care of those people. And I think we're going to really depend on that person for looking specifically to take care of that population.
Thank you. Patty, could you address the question about, this is actually a private question, but wondering when folks will be able to make lab appointments? Can they make an appointment now to begin in April?
Yes, absolutely. They can call now and get appointments for starting the 5th forward.
Great, thank you. Okay, those are all the, oh, one more question. What will the difference in how the clinic interacts with EMS be? Charles, maybe you could address that question.
And I've spent quite a bit of time over the last year here working closely with Chief Williams, learning about our community. My background is also EMS, and this is a very close partnership with the clinic, with Island Hospital, EMS, both during normal working hours and after hours. I've seen a lot of things since I've been here. I've seen people being diverted away from the clinic to the firehouse for acute care. Somebody seeks emergency care from the clinic on a walk-in basis, we will work to care for them and bring EMS to us. We will be talking after hours, part of medical control with their medical director, and we will be working together on a monthly, quarterly, and daily basis to learn about the dynamics here, to see what needs to stay here for normal working hours, after hours, and how to assure that air medical is used in the most appropriate way and not just to send them off the island. We'll work to try to keep our community, our residents here.
Yeah, just a brief bit more. I'd like to add that I talked with Scott today about that and explained what our after hours call procedures are going to be, and he was delighted. I mean, he could speak up for himself, but I was really excited to explain that we're going to have physicians answering the phone. We're going to get high quality triage for care. I'm looking forward to a very much improved relationship with EMS. They're a critical part of the team. I also talked with Island Air that does a lot of I think there are 1,500 people on the island that have a contract with them to fly off if they need to be flown off. They're also excited to be partners with us, and I couldn't be more excited to work with them. We've also had some brief discussions about roles they may play in providing care to the more remote locations as well. So I think I'm looking forward to a renewed and very strong relationship with EMS at all levels. And I think that's one of the places where we're going to be able to innovate and provide new levels of care and a very supportive, cooperative relationship. I'm really excited about it and looking forward to it.
Thank you. So those are all the questions that I see in my chat. Just one more time, anyone on the team get any private messages that we need to speak to?
Yeah, absolutely. I see a couple others, and that's about our EMR, Meditech and Epic interface and the record management system. Patty or Elise, do you mind speaking a little bit more in depth to Epic, Meditech, our Meditech, and how our patients can interface or use it?
You bet. I'm happy to do that. And I want to make sure that we know that we are including the EMR patient records from Orcas family as well as Epic. There's several layers. There will be CCDs, continuing care documents that we will get from the UW and from Orcas family. Those will go into medical records automatically. It's an electronic process. Another layer of that is we will have staff that will have access to Epic and access to Quantum, and they will manually translate data from those EMRs into Meditech. We have a Divine data set that they will be building your records off of. And then there's a visit prep, we call it, when we're getting ready for an appointment with a patient in the clinic. We do another circle back to those other records and make sure we have everything we need that the provider might need in your medical record before your visit. And then finally, when you're there in the clinic, if there's records that are highlighted that should be part of your record, we pull those over as well.
Thank you. One more question, Patty, that maybe you can speak to. Someone was asking why we haven't added a toll-free number rather than sending folks to the 293 number. Would that affect our call order system?
I don't know. That's a great question. I'm going to make a note, and Laura, I'll get back to you, and maybe you can put it in our FAQs.
Okay.
But it's a great question. I'll look into that.
Thank you. See, Charles, this one may be for you. It says, it appears that one or more doctors who chose not to join the Island Hospital team may set up their own independent practices on Orcas. What impact will that have on your business model? Does success of the Island Hospital plan hinge on being the only practice?
Well, I can tell you that we've been invited to reply to a request for proposal and invited to do a practice here based on a one clinic model. We've looked at the past, we all have with the commissioners here, and realized for our community here, multiple practices make it very difficult for any one clinic to be successful. And so our goal is to provide the very best care to our community here in the best way that we know how.
I'd just like to add to that, if I could. You know, I've watched Orcas struggle for 30 years now, And I've watched people come in, not be able to make the living that they expected, sometimes have philanthropic efforts by individuals or even groups to make things float. And I've seen those efforts fail time and time and time again. One of the reasons I decided to take on this role is I think that one clinic model really will work. Now, if there was an effort to recruit those physicians into this clinic, I myself talked with Camille and tried to get her to join us. And she really needs some time off, and I respect that. And I think that's what two of the providers said really was they needed time off. They were really burnt out by the experience they'd had with the university. And I understand that because I was really frustrated with the university. I've interacted with them about any number of issues and felt the lack of response is pretty dramatic. Not even being able to get a phone call back. If providers choose to have their own clinic, that's something they're welcome to do. But I believe that the community supports a single clinic system, and I'm hoping and inviting all of you to join in that. I think that can succeed. I think if we go back to a model where there's a plethora of clinics, the finances simply don't work. Now, when that lovely young pediatrician came here, a wonderful guy. I came over, I sat down with him, I listened to his idealism and his desire to have a clinic here and his being in love with Orcas. But I had to tell him, it takes 2,000 people to make a living. You know, you really got to think this through. I pled with him to think it through. He came, he was here for 3 years. He ended up with 385 patients and he went bankrupt. It was heartbreaking because he was a nice guy, really nice guy, smart, good quality care. But, you know, some things work and some don't. I studied the classics once, and one of the things that made a deep impression on me was Aristotle. Aristotle said, in framing a utopia, assume whatever you like, but avoid the impossible. We really need to make sure that what we're going to do works. We have the district board fully in support of what we're doing. We've got a great hospital partner with it's not just Charles, he has a whole team of people behind him that are quality people. We've got a whole team of providers that can provide excellent care for Orcas. I just want to invite you to join us. You know, at the end of the day, we have to earn every single patient. We've got to deliver good care, solid care, quality care, caring directly for people. I only want to have people on my team that want to care for people and are capable of caring effectively for people. And, you know, people will be able to choose what they want to do. I think that we can put an extraordinarily capable, competent group of people out there to provide care for you. I also think that we're going to answer the stinking phone. You know, we need to be able to do that. You saw how many people were on that list that answer the phone. There's a lot. You're not going to be frustrated by that. The other thing I think you're going to get is caring people, because the people I'm involved in hiring every person. And you know what? I'm only picking people that care. They can be technically as good as they want. They have to really care about people, or I don't want them on the team. So I hope that you know that we're making every effort to make this as high a quality as possible, that we'll earn your trust, we'll earn your respect, we'll earn your support. And we can't control what other people do. They're gonna do it. And that's totally fine. And there may be niches that work for some people. But it is really hard to make a living here. You know, in order to put on the table what we're putting on the table for you today, it takes a substantial subsidy from our taxing district, over $1 million every single year. That's what it takes to deliver quality care. The other thing is we've got a workable, realistic solution to have a physician call in the middle of the night. When you need somebody, you're going to call, you're going to talk to a doctor. If you need care in the clinic, we're going to be in the clinic to see you. 1 or 2 people can't do that. They simply can't do it. And they can't dump that responsibility on other people. That's not okay. I'm not going to be on call for other people in the middle of the night. I'm going to be on call for our patients. So I hope you want to join us, and I hope that they think very seriously about what they're doing. They may choose to do that, and that's okay. I don't mind that they try. But I can tell you, it takes a big effort to really have responsible medical care in this environment. We have to be fiscally responsible, and we have to be morally responsible to each and every patient that we're going to be there to care for them. And that's my commitment to you. And I think our commitment as a team is we're going to give you quality care, moral care, responsible care that's going to be able to really meet your needs. I think we've got the team together to do that. Thank you.
Thank you. I don't see any additional questions. Charles, would you like to end our meeting tonight?
Absolutely. I definitely want to thank all of you who spent this evening with us from your households. We actually looking forward to a positive year, better than the last year as the pandemic restrictions start to lift, as the vaccines get into our arms and we're able to be together more without masks here in the future sometime. Looking forward to meeting you, looking forward to being part of the fabric of this community and providing the very best care. Thank you all for those who have helped put this together on our team. Thank you for spending some time. And I look forward to opening up a clinic on April 5th here in about 18 days. Thank you, everyone. Have a great evening.